I'm Rick Buck, and I've been a dentist for 17 years. In this video, I will go over how I do crowns on lower front teeth. The patient here isn't very happy with her front teeth because she doesn't like how the biting surface has rings that look almost like a target on top of them. The best way to remedy how these look is to do crowns on them. Since the patient obviously has ground these teeth down, I want something stronger, so I opt to go for crowns. So after the patient is numb, we start by filing the teeth down for crowns. Now, the target look on the biting surface of the tooth is because she has ground down her teeth to the underlying levels, and each level has a shade that is slightly different from the level in front of it. And thus it gives that target look when you grind them down to expose all the different layers. The problem for us is that to fix this, we have to file down a tooth that's already been ground down naturally in the patient's mouth. And so we have to file it down even further. And when we file it down further, that doesn't leave a lot of tooth for these crowns to hold on to. Luckily, her gum level is a little high, so we can take down the underlying gums and we'll have enough natural tooth to hold on to, and everything will still look good and we'll have plenty of tooth structure that a crown can hold on to. So we file the tooth down 1.5 millimeters in every direction around the circumference of the tooth and off the top. This means we drill at least 1.5 millimeters off the top, then all the way around the circumference. As I file around the circumference of these teeth, I'm checking for a few things. The stump, or the tooth that is left behind, has to meet a few criteria for a crown to fit nicely on top of it. The circumference of that stump is called the walls of the tooth. We need all the walls of the tooth to converge at about a 5 to 10 degree angle. If it is more than that, the final crown is more likely to come off in time. If it is less than that, the crown may not fit on the tooth because it's undercut, or it might even get stuck on the tooth as you're trying it in and then you can't get it out. Either way, 5 to 10 degrees will give it a lot of retention and still allow it to fit. We removed the 1.5 millimeters because the crown is going to fill in all that negative space that we drill away. If you just put a crown on top of the tooth without filing it down, when you bite down, you would only bite down on those teeth due to the added thickness. And the thickness needs to be at least 1.5 millimeters to resist breaking. Remember, the patient is going to chew over and over on these things for the course of their life. The margin is the end point where we drill all the way around the circumference of the tooth. The margin is important for a few reasons. The biggest reason is that this is where the tooth and the final crown will meet and is the weak point of the tooth and the crown. There needs to be a smooth transition from tooth to crown, or decay and bacteria can easily enter, hide, and cause cavities here, making it impossible to clean if done improperly. Once I am done preparing the teeth for crowns, I should be able to look down on the tooth and see that the complete walls all the way around the tooth are converging at a 5 to 10 degree angle. I then check with the patient biting down that there's 1.5 millimeters of clearance between the top and the bottom remaining teeth. If there is, then I move on to the impressions. Actually, before I get to the actual impressions, I have to stop the gums from bleeding so I can get a detailed impression or scan. I usually take a scan of teeth when I am making these crowns, but I have other videos if you want to see impressions too. Quickly, before I get to the most interesting part, I developed the best toothbrush, floss, and other dental products that are in Amazon affiliate links in the description. Those dental products will give you a stunningly clean mouth. You should watch my videos about why they are the best, posted at the end of this video, so you brush and floss with superior results. Here, I simply just take the scanning wand and move it all around, and it will pick up a 3D image of the teeth. It's pretty awesome and is much more accurate than taking conventional impressions, in my opinion. I take a scan of the lower teeth, the top teeth, and then how the lower and the top teeth bite together. And so that way the lab will know exactly where to put the tooth and how thick to make it. I then make a few notes for the lab, including the shade of the teeth, and I also mark the margin of the tooth on the computer. And I send the scan to the lab, and the lab will 3D print out models and make crowns on top of this impression. To end this appointment, we make temporary teeth. Now, these temporary crowns, as you can see, are fashioned after the patient's previous or old teeth, and they won't look as nice as the patient's future teeth that they will be getting in a couple weeks or days. If the patient wants these temporary teeth more cosmetic, they will have to come in for an extra appointment before this appointment and it will cost a little bit more, so we can prepare a temporary bridge that will look nice for them the day these are filed down. Normally patients don't mind, even though they don't look near as nice as the other ones, of having these teeth fashioned after their old teeth for a couple weeks. So after a few days to weeks, we get the crowns back from the lab. My lab is awesome. If you are a dentist in the United States and you have a scanner, their information will be in the description of this video. These are the crowns that were made on the 3D printed model of the patient's mouth. When the patient returns, we try the permanent crowns in the mouth, and we are observing for 5 things. First, we make sure the crowns contact the adjacent teeth adequately so they won't get food caught in them. Second, we ensure the crowns sit down all the way and don't rock when they are seated. Otherwise, they would likely loosen in time or maybe have other issues. Third, we make sure where the tooth and the crown meets is flush. Otherwise, cavities can easily start at the margin. Fourth, we check the patient is biting evenly on the crowns and adjust it if needs be. And fifth, we make sure the crowns look good. Our patient loves them, I love them. You will notice these crowns are slightly wider and look nicer than the rest of the teeth. The layers of those shades, that bullseye or target look, are gone, and the teeth even look more nicely proportioned than before. And that's because we lengthened them a little bit. The patient will eventually have the crowns done on the upper teeth to match these crowns, but these crowns met all our parameters, so we cement them in with a glass ionomer that we mix up, holding them firmly into place. It will set after a few minutes, and then we just clean off the excess cement. This stuff is extremely strong and will hold the crowns in for the rest of the patient's life if they take care of them well. Let's look at the before and after of everything. We do just need to do some of the other crowns to get everything matching beautifully. Watch all my daily tooth care videos I have posted now for the best techniques, tips, and products for a stunningly clean mouth that avoids tooth decay and gum disease and gives you fresh breath. My dental products are in Amazon affiliate links in the description below, and if in Southern California, my dental office is in the description as well. Like and subscribe to my channel if you have teeth.